Hi everyone, Justine here. Hope you all have been well. So today I really wanted to talk about something that I think is a very important issue, but a little bit heavy. So bear with me and I'm going to try to make this as much as possible very educational for you all and something that is actionable. Now, what really brought on this video was the reports of 22-year-old Mahsa Amini's death in custody of the Iranian police. And if you haven't heard about the story yet, Mahsa Amini was taken in by police for reportedly not wearing her hijab correctly according to their rules, and witness reports stated that she was severely beaten in the van on the way to the police station. She ended up collapsing at the police station, and this was taken on live camera, and ended up in a coma and died 3 days later. So obviously this was a really horrible, tragic incident and has triggered a lot of protests around the country regarding women's rights and the question of the morality police in Iran. And I just felt that in the context of everything else that has been going on in the world in the last couple months, with in the United States, Roe v. Wade being repealed, and now there are also lots of questions in certain states about whether women will even have access to things like the morning after pill, which is a form of emergency contraception. I just felt like addressing gender-based violence and women's rights in the context of healthcare and what we as healthcare providers or even as medical students can do in the situation was really important. So gender-based violence can take on many different forms, some of which are physical, some of which are psychological. And I just wanted to take a moment to highlight how prevalent this issue is, where a 2018 report by the World Health Organization found that 30% of women over the age of 15 had experienced some kind of gender-based violence. And actually in the Americas, the prevalence among women aged 15 to 49 was even higher at 34%. So you can imagine that roughly 1 in 3 women who are presenting to your clinic may have experienced gender-based violence. This is something that's going to be extremely common in your patients when you are coming into clinic, so to be aware of that is really important. Now, a form of gender-based violence that I think a lot of providers may not be very familiar with, depending on what community they are from, is female genital mutilation or female genital cutting, FGM. It has lots of different names, but essentially in some communities there is a practice of doing various types of cutting onto female genitalia in order to make women essentially more pure or less likely to be sexually active or promiscuous. And I want to be clear that this is something that has a history in the United States, where I'm from and where I know a lot of my viewers are either practicing or living. And even as recently as 1977, female genital mutilation was actually covered by insurance, if you can believe that. And this was even a few years after Congress had already outlawed this practice. So I'm going to include a link below from the World Health Organization to educate you more about this topic and the types of cutting that you might see, as well as how to kind of address this in clinic and just more information about the topic, because it's something that I think is not very much discussed at all in reproductive health, at least here in the US. And related to that, I want to take a moment to express that everyone's experience is highly individual. Even on the topic of FGM, there are many women who actually are in support of it and see it as a deeply cultural practice for them and something that, Western society should not be trying to take away from them. At the same time, there are also many women who have experienced lots of chronic negative health effects due to FGM, such as pain and difficulty with urination, difficulty giving birth. And so those things are not to be ignored and those need to be addressed. And to realize that when someone comes in and they have experienced FGM in the past, that these are the kinds of health conditions they may be presenting with. So that is a little bit of background, but what can we do as healthcare providers to help make this issue better? Unfortunately, there definitely are things that we can do, and I'm going to start with one, which is trauma-informed care. which is something that everyone should definitely be familiar with and educate themselves on, and really try to train themselves in terms of how am I going to speak about these issues that are highly sensitive, can be stigmatizing, and make people feel super vulnerable, even more vulnerable than they already are coming into clinic with health issues. So one of the, I think, key examples comes with physical exam maneuvers. So even just recently, as we're going over the musculoskeletal unit at my university, some of the practices that are done in order to test muscle strength can potentially be traumatizing to patients. So the classic kind of line that is used when you're testing muscle strength, so for example, if I was testing a patient's arm strength, is that I would push down on their arm and then I would have them try to push up. And so in that case, a lot of clinicians, or I guess the standard way of instructing patients on this, is to say resist my touch or resist my hand. And just even on the face of it, it sounds a little bit off, right? But it's especially potentially traumatizing to patients when you're testing things like hip adduction. So hip adduction being your ability to close your thighs, essentially. And you're going to be literally trying to open up their thighs and telling them to resist you. That's clearly not a recipe for success in terms of making patients feel comfortable. So language that I like to use, and you can think of kind of what works best for you, is instead of saying, resist my touch or resist my hand, I would say, like, when you feel pressure, push into my hand or something like that. And other things like draping to make people feel comfortable during physical exams is something that thankfully I feel like we are taught pretty well on. But just to be conscious of the fact that your language and the position of power that you are in relative to the patient is salient and important, and that we can really make a positive difference in people's lives if we are educated about that. And the second thing that I want to mention for all of my healthcare providers out there, especially those who are in the US right now and who are potentially dealing with the after effects of Roe v. Wade being repealed and all of the myriad issues related to that, especially when it comes to criminalization of providing certain reproductive health services, that it is really valuable to advocate through professional societies. Whether that is like the AAMC if you're a student, or if you're in academic medicine, whatever national organization that is applicable to your specialty, that can make a really big difference. And pooling kind of your resources together in terms of a position statement or advocacy on Capitol Hill or in your local legislature can definitely make a difference, and has made a difference in the past. And that's something that I have even been advised on by faculty at my own university. So it cannot be stressed enough that your position as a healthcare provider holds authority, and that there are things you can do to advocate for your patients and for women's rights through healthcare in society. Now, the last thing I want to mention are to help bolster the programs that are at your hospital or in your community to address gender-based violence. So, for example, at my hospital, we have a violence intervention program, and they do a lot of really great work with the community. And as healthcare providers, I think one of the most important things that we can do when we have these cases that are very complex and have not only the kind of physical health component, but also have a lot of social aspects to what the patient is experiencing, is to be able to connect them to social resources and to know what those resources are. So if you have social services well connected in your clinic, obviously you're going to lean a lot on that, but also just knowing what nonprofits are in the area and being familiar and partnering with these organizations can be really powerful. So this was a short and hopefully educational video for you all on what I felt was such a pressing topic today in terms of what we can do as healthcare providers to help our patients and kind of make this world just a better place for everyone. So I hope that you all have a great rest of your day, and I'll see you in the next one. Bye!